Welcome back to Inside Chlorpromazine, the podcast where we uncover the science behind chlorpromazine and its intriguing connections to viral infections, chronic conditions, and beyond. In the previous episodes, we have discussed how chlorpromazine influences viral replication, inflammation, and even potential treatments for long COVID. Today, we are going to focus on an equally fascinating topic, the blood-brain barrier. What does it take for a drug to cross this formidable barrier? Can chlorpromazine make it into the brain? And what impact could this have on its use in viral infections and post-viral syndromes? I am once again joined by Chythanya, a microbiology researcher with a deep understanding of neurobiology and the blood-brain barrier. Welcome back, Chaitanya.
Thank you for having me back. The blood brain barrier is such a crucial part of how the body protects the brain. So, discussing how chlorpromazine interacts with it is a really exciting area of research.
Let's start with the basics. What exactly is the blood-brain barrier and why is it so important?
The blood brain barrier, or BBB, is a highly selective semi permeable membrane that separates the circulating blood from the brain and spinal cord. It serves as a protective mechanism to prevent harmful substances from entering the brain while still allowing necessary nutrients to pass through. The blood-brain barrier is made up of specialized endothelial cells that form tight junctions, preventing unwanted molecules from slipping through. The barrier is crucial because the brain is extremely sensitive to toxins, pathogens, and other harmful agents. However, this also makes it challenging for drugs to reach the brain, which is why we have to be particularly careful about how we design treatment for neurological conditions.
So, can chlorpromazine cross the blood-brain barrier? It's primarily used for psychiatric disorders, and we know it has neuroactive properties. So, how does it get into the brain?
That's a great question. Yes, chlorpromazine can cross the blood-brain barrier. This is one of the reasons why it's effective in treating psychiatric disorders like schizophrenia and bipolar disorder. Chlorpromazine is a lipophilic or fat-soluble molecule, which means it has an easier time crossing the BBB compared to hydrophilic, which means water-soluble molecule. So, once it crosses the barrier, chlorpromazine exerts its effect on dopamine receptors and other neurotransmitter systems in the brain. Its ability to affect these pathways is what gives it its therapeutic effect in mental health, but also could have implications in treating neurological symptoms in post-viral syndromes like long COVID.
In the context of COVID-19, some patients experience neurological symptoms like brain fog, headaches, and loss of taste or smell, which might suggest an impact on the brain. Could chlorpromazine have any role here, given that it can cross the blood-brain barrier?
Absolutely. During viral infections like COVID-19, the virus can affect the brain either directly through viral entry into the central nervous system or indirectly through the immune response. In fact, there is emerging evidence that the virus might disrupt the blood brain barrier itself, making it easier for pathogens to invade the brain. So, chlorpromazine being able to cross the blood brain barrier could potentially help modulate the neuroinflammation that's often seen in these cases. By targeting receptors in the brain that are involved in dopamine signaling and inflammation, chlorpromazine could help alleviate symptoms like brain fog and fatigue, which are common in both acute and long COVID cases. Additionally, the chlorpromazine has been shown to have some antiviral properties as well, which could be beneficial if the virus is contributing to the neurological symptoms. However, we have to keep in mind that this is still in an area of research and more studies are needed to fully understand how chlorpromazine could be utilized in this context.
Beyond just treating symptoms, could chlorpromazine potentially provide any neuroprotective benefits in the context of viral infections and post-viral syndromes?
Yes, chlorpromazine does seem to have some neuroprotective effects, although this is an area that requires more exploration. It has been suggested that chlorpromazine's ability to modulate dopamine and other neurotransmitters could help protect neurons from damage during viral infections. For example, the virus may cause an excessive immune response in the brain, which leads to oxidative stress and neuronal injury. So, chlorpromazine, by interacting with dopamine receptors and influencing dopamine signaling, might reduce some of this neuroinflammation and oxidative damage. In the case of long COVID, where neurological symptoms persist long after the infection has cleared, chlorpromazine's potential to balance neurochemistry might offer relief. Moreover, chlorpromazine has been shown to reduce oxidative stress, which is one of the primary causes of neuronal damage during infection. By protecting against this damage, it could help mitigate the long-term neurological effects seen in post-viral conditions.
While the potential benefits sound promising, are there any risks or considerations we should keep in mind when using chlorpromazine, especially in patients with neurological involvement?
Absolutely. Like any drug, chlorpromazine comes with its share of side effects, especially when used long term or high doses. Some of the most common side effects include sedation, weight gain, dizziness, and even movement disorders, like tardive dyskinesia. This is due to its impact on dopamine receptors in the brain. Moreover, chlorpromazine can have an impact on cognitive function and memory, which could be a concern for individuals already experience brain fog or other cognitive issues due to viral infections. For this reason, it's crucial to use chlorpromazine with caution, particularly when dealing with the patients who have pre-existing neurological conditions. It's also important to note that while chlorpromazine has potential neuroprotective effects, it's not without risk. The key is finding the right balance, using it in a way that provides maximum benefit while minimizing potential harm.
So, given its ability to cross the blood brain barrier and its potential in treating neurological symptoms, where do you see chloropromazine in future research, especially in relation to viral infections and long COVID?
I think chlorpromazine has a lot of potential use in these areas. As we continue to understand more about how COVID-19 and other viral infections impact the brain, drugs like chlorpromazine could become part of comprehensive treatment strategy. The ability to address both neurological symptoms and immune modulation makes it an attractive candidate, particularly for post-viral conditions like long COVID. I would also love to see more clinical trials focus on its role in treating neuroinflammation, cognitive dysfunction, and post-viral fatigue. The research is still in its early stages, but chlorpromazine could play an pivotal role in the management of not just acute viral infection but also their long-term effects.
Incredible to think about how a psychiatric medication like chlorpromazine can potentially be used to treat neurological complications caused by viral infections. As always, it's important to remember that future research is needed to understand its full potential. Thank you, Chaitanya, for shedding light on how chlorpromazine interacts with the blood-brain barrier and its potential role in treating the neurological symptoms of long COVID. In the next episode, we'll be diving deeper into chlorpromazine's antiviral properties and how it might help viral infections at the molecular level. Until then, thank you for tuning into Inside Chlorpromazine, where we continue to explore the surprising and scientifically fascinating world of this unique drug.